Representative Beth Van Duyne, it's good to see you again this morning.
It's great to see you. Thank you for having me on.
So I've been speaking with some nonprofits here in Texas that fight poverty, and they tell me they are really worried right now. They say Texans are hurting, and they're not 100% sure that the folks in power in Washington understand how bad things are right now. So are you concerned, and do you get it?
Well, look, we got it. The House Republicans did our job. We sent over a bill that would have kept the government open. What we've seen now is it's going to probably be the 15th time that Democrats in the Senate are going to vote to keep the government shut down. So yeah, we get it, and we are in touch with these folks that are in our district. We sent out a survey. In fact, we asked. I just kind of want to read you the numbers. We sent out a survey to 160,000 people last week. And we asked them if they were being impacted by the government shutdown, and we had about 2,600 responses. 55% said they weren't impacted by the shutdown. 26% said they were. That's almost a quarter of all of North Texas folks that responded to the survey, and 19% had mixed messages. Now some of the people that were impacted by it could have been flight delays. It could be people who are trying to get their passport, people who are waiting on SBA loans. But this is an avoidable government shutdown. It did not need to happen, and I will tell you, it was a compromise CR that the especially the fiscal hawks in the Congress sent over. This was a bill that for dozen plus times Democrats had supported when Biden was in office. This was a clean CR. There was no policy riders to it. There was no decreases in spending. This was a clean CR meant to give Congress more time to be able to negotiate these issues, just to keep the government from shutting down. And what we have seen is these radical leftists in the Democrat Party are holding this open. And if you look, there's such a stark difference now between the Democrats and the Republicans. Just look at this last month alone. The peace deals that this president has been able to bring forward, the tariff deals and trade deals that he's been able to bring forward, the foreign investment in the U.S. economy, our bill that we passed for our working families and tax cuts that is focused on bringing manufacturing back to this country, that is focused on giving people tax cuts, that is focused on allowing people to have more money in their jobs, more job opportunities, more money in their pockets, growth to the small business sector. Those are the achievements of the Republicans. What we've seen Democrats do is, double down on, men and women's sports, looking for right now the $1.5 trillion that they wanted to bring back this bill to be able to have a discussion about it. $1.5 trillion, vast majority of that was for providing illegal aliens health care. It has got to stop.
You say that, but many people have said that health care cannot be given to people who are in this country illegally. And
they say that, and yet you've seen, Democrats like Gavin Newsom who absolutely admit they are doing it in their state.
But nationally, it's illegal. Nationally, it does not happen. People who are in this country illegally cannot get health care. But
they can. But they can. Anybody who goes to a hospital can get health care. They're not going to be turned away. And then those hospitals are reimbursed. People who are here that are waiting on asylum claims, which, by the way, 86% of all asylum claims are denied. People who are here waiting on asylum claims, the 10 plus million people that were allowed through, under the Biden administration, they do get temporary benefits. They absolutely do. So I know that that's an argument that we've heard from our Democrat colleagues. It's absolutely not true.
Well, let's bring it back to the real impact on North Texas families, because Democrats will say, that they shut the government down in order to try to extend the subsidies that make healthcare more affordable through the Affordable Care Act. Prices for 2026 did just come out last week. It looks like overall average increase is going to be 30% higher for people. What do you say to your constituents who say that's going to break the bank and I can't afford 30% more?
I'd say what we were arguing when we were all against all the Republicans, because none of them voted for it, when we were against the Affordable Care Act, that has done nothing to make health care affordable. What it has done is benefit health insurance companies. And I think my Democrat colleagues have a very hard time deciphering between health insurance and health care. They are two totally different things. And what the ACA has done is increase the profits of health insurance companies by 230%. what we've seen is increases in the amount that families are paying for their their healthcare premiums has gone up 86%, all while their claims have been declined by these same health insurance companies that are experiencing record profits, have had declines by a third. Nearly a third of their claims that they're paying for are declined. So I would say, my Democrat colleagues, your attempt, your experiment with the socialist healthcare has completely failed. It has increased the cost of healthcare. It has decreased access. It has decreased quality. And if you really want to talk about healthcare, come back to the table. Stop holding the entire country hostage. Come back to the table and let's talk about healthcare. But let's also acknowledge the fact that the ACA was a complete and utter failure.
With your party in charge of the Senate, the House, and the White House, do you bear no responsibility for any of this?
Again, I think what you've seen from the House, we did our job. You need a simple majority to be able to pass a bill out of the House. We did that. You say that we're in charge of the Senate, except for the fact that you have to have 60 votes, and you currently have 53 Republicans. So if we could get 6 of our Democrat friends over there to do the right thing, and to vote, to common sense, and to vote in the best interest of their constituents in the country, yeah, we could. But the fact is that unless you've got 60 votes in the Senate, you're kind of at a point where you're stuck. You're stuck. Now, that is the way that our that's the way that we have always run our government. We want to make sure that the party that's in the minority still has a voice. But at this point in time, I think they're abusing their voice.
I do want to talk to you about the Supplemental Nutrition Assistance Program, SNAP, what some people call food stamps. As we are recording this, 3.5 million Texans have received word that they are not going to get SNAP benefits funded on November 1st. This helps them cover the cost of groceries. There could have been, they could have tapped into the emergency reserves in order to fund SNAP. Are you okay with the emergency reserves not being used, and are you okay with SNAP not being funded?
Well, a couple things. One, I think what the legal opinion was is that you can't just tap into it, that the emergency funds are there for emergencies. I was part of the first Trump administration. I worked for Secretary Carson at HUD when Hurricane Harvey happened. When those are the types of emergencies that this fund is set aside for. So you're seeing hurricanes currently, happening around our country. When we have those types of events, you want to make sure that you've got those access to those dollars. This fund was not set up for a planned government shutdown that Democrats have created. If they are concerned about the SNAP beneficiaries in their district, call your senators. Tell them to do the right thing and tell them to vote on opening up the government. They're going to have an opportunity a 15th time to do so.
Are you surprised that the shutdown has lasted this long?
I am. When I was first asked about it, I was on an interview like 1 minute after it started, and somebody asked how long it was going to, I was assuming it was going to last. My odds were 5 to 7 days, because I figured what was going to happen was you were going to see Russ Vought come out with a list of programs and agencies that were going to get shut down. That has not happened. I think what you've seen is that an administration has been very strategic in looking at potential cuts, but has also been very strategic in not wanting this shutdown to affect the vast number of Americans. And so they have been trying to figure out how to get WIC covered, for our women, infant, and children program. They have been trying to figure out how to get our military paid. But at some point in time, these dollars are going to dry up. And look, I'm in North Texas. Everybody flies in and out of DFW Airport, and it's right smack dab in the middle of District 24. And you are going to experience delays and some cancellations of flights that are going to affect anybody who travels. And you think about what this shutdown causes for like air traffic controllers, people who are being trained right now. That's not happening. So you're going to see delays, not just during the time that the government is closed, but in the future. And again, it's all avoidable.
Do you think there could be a deal anytime soon?
I would hope so. I think when you see some of the most liberal employee unions that are now going after the Democrats and saying, knock it off, stop the partisan politics, stop the political games and the political theater, get back to work, pass a clean CR. You've done it a dozen times over the Biden administration. This is your level of spending that you're supporting. Stop adding $1.5 trillion wish list on top of it just to get our federal employees paid. I think people are going to get sick of it. I think folks are going to start being much more vocal, especially as they are affected by it. And then you're going to see the Democrats come back to their senses, at least I hope, 6, 7 of them that will agree to do the right thing.
Congresswoman, thank you for your time.
Thank you so much. I hope you have a great day.